You know, for decades, we've all been told one simple rule for strong bones. It's a piece of health advice that's pretty much become a mantra. We've all heard it, right? It's Health 101. Doctors say it, our parents said it, you see it on commercials, and the logic, it seems rock solid. Bones are made of calcium, so to keep them strong, you just need more calcium. Simple, straightforward. And for a lot of us, it's a daily ritual. What if that advice, as well-intentioned as it is actually incomplete? What if that very supplement you're taking to keep your bones from breaking is accidentally causing a way more dangerous problem somewhere else in your body? This is the heart of what scientists are now calling the calcium paradox. So check this out. Doctors started noticing this really bizarre situation with their patients. They'd come in with osteoporosis, weak, brittle bones, but then their scans would show their arteries and heart valves were severely hardened with calcium. How is that even possible? They obviously have plenty of calcium in their bodies, it's just ending up in all the wrong places. So, and this is the crucial point, the problem isn't a lack of calcium, not at all. It's a distribution problem. It's like the body has all the bricks it needs, but it's completely lost the blueprints for where to put them. So, the calcium that should be making your skeleton strong is instead setting up shop in your soft tissues. And that brings us to how this is all happening. You have to think of calcium as a dumb nutrient. I know, it sounds funny, but it's a vital building block that has absolutely no idea where it's supposed to go on its own. So, when you take a big old supplement, it floods your bloodstream, and without a guide, it just drips and settles wherever it wants, which is usually not where you want it. And this really highlights the danger here. The goal, of course, is strong, dense bones and a healthy skeleton, but when that calcium doesn't have a guide, the risk becomes hard, brittle arteries and stiff joints, which is a massive risk for your heart. You're trying to solve one problem, but you could be creating a much, much bigger one. So, where is all this rogue calcium coming from? Well, the great irony here is that the number one culprit might be sitting in your medicine cabinet right this second. No, seriously, I want you to go check. If you take a calcium supplement, just hit pause and go look at the label on the bottle. Does it say the main ingredient is calcium carbonate? This is so important. If it does, what you're holding is essentially chalk. I'm not kidding. Calcium carbonate is the cheapest, most common form they put in supplements, but it is notoriously hard for our bodies to absorb. You need a ton of stomach acid to break it down, and that's something that naturally goes down as we get older. And because it's so poorly absorbed, it's way more likely to just float around in your bloodstream looking for trouble. Okay, so we've got a distribution problem, we have a dumb nutrient, and a form of it that's hard to use. So what's the solution? Well, we need a guide, right? We need a nutrient that can act like a traffic cop for all that calcium. And that hero nutrient is vitamin K2, specifically a form of it called MK7. Now, this is not the same thing as vitamin K1, the one you get from leafy greens that helps your blood clot. Nope. K2 has a totally different job, and it turns out it's the missing link in this whole bone health equation. So how does K2 actually do its job? Well, it's this really cool three-step process. First, vitamin K2 flips a switch and activates a special protein called osteocalcin. As soon as that protein is activated, it becomes like a magnet for calcium, literally grabbing it right out of your bloodstream. And then, for the final step, it carries that calcium and deposits it directly into your bones, exactly where you wanted it to go in the first place. Without K2, that whole process just doesn't work. But K2, as amazing as it is, doesn't work alone. To really truly solve this calcium paradox and build strong bones the right way, you need a whole team of nutrients working together. We like to call it the complete bone stack. Just think of it like a three-player team. First, you've got vitamin D3. He's the gatekeeper, opening the door to let calcium into your bloodstream from your food. Then, our hero, vitamin K2, acts like the driver, making sure that calcium gets chauffeured all the way to its proper destination, your bones. And finally, you've got magnesium, the relaxer, which balances everything out and prevents issues like muscle cramps. It's a perfect system when they all work together.
Now, supplements are one way to go, for sure, but you don't always have to rely on a pill. You can actually get these critical nutrients right from your diet. You just have to know what to look for. For vitamin K2, the absolute best sources are fermented foods. Natto, which is a fermented soybean dish, it's an acquired taste for sure, but it is the hands-down champion. You can also find K2 in things like sauerkraut and good quality aged cheeses like Gouda. And for a better form of calcium, try sardines with the bones in, or leafy greens. They come naturally packaged with other minerals your body needs to use them properly. So really, the big takeaway here is simple, but it's incredibly important. Taking care of your bone health means being a little smarter than just popping a single nutrient by itself. The bottom line is, don't turn your arteries into stone trying to save your bones. That really leaves us with a final thought, doesn't it? This whole situation is a perfect example of a healthy habit that, without the full picture, can actually have some pretty serious unintended consequences. It really makes you wonder what other common health advice out there might be missing a crucial piece of the puzzle.